Good day everyone! Today I'm going to perform the procedure of hand washing. But first, allow me to state the purpose of it. We wash our hand to prevent the cross-contamination and the transmission of organisms to oneself. Also, hand washing lessens the organisms on our hands and reduces the transmission of organisms to our clients. Then now, let's move on to assessment. Determine the client's status like the presence of factors increasing their susceptibility and the possibility of undiagnosed infection. Then determine the use of client on the immunosuppressive medication and their current nutritional status. Then also identify for the recent diagnostic procedure or treatment that may penetrate their skin or their body cavity. Then lastly, assess for the signs and symptoms that may indicate infections like pain, swelling, redness, or tenderness with palpations are the signs of localized infection. Then next is, for the preparation, determine the location of our running water. Then assemble for the equipments such as sanitized towel, disposable tissue, bar soap or a liquid soap, then the running water. Then assess the nails. Nails should be kept short because it harbors microorganisms. Also, for the jewelry, it must be also removed because likewise it harbors microorganisms. Then also check for the any cuts or hangnails on our hands. Then for the procedure, if we are washing our hands, where the clients could observe us, tell them what are we going to do and why is it necessary. For example, good morning Mrs. Vigilla, I'm going to do the hand washing because to prevent the microorganism to be transmitted. Then wet our hands thoroughly. Make sure our hands are below of our elbow because we are washing our hands from the cleanest to the dirtiest. Then apply a soap. If you are using a liquid soap, use 2 to 4 ml or 1 tablespoon. But if you are using a bar soap, wash it first. Then lather to your hand firmly. Then palm to palm. Then right over left dorsum. Then with interlock. Then vice versa. Then followed by palm to palm interlace. Make sure to remove the dirt between your fingers. Then back of the fingers, opposing the palm, interlock. Then do it to the other side. Then the rubbing of the thumb, the rotational thumb. Then the fingertips, backward and forward. Then lastly, the rotational rubbing of the wrist. Then after that, you can now rinse it. Make sure to remove all the soaps in your hands. Then now you can dry it using a towel or a disposable tissue. Use the other side of the towel on your hand and the other side of your hand. Then you can now use a disposable tissue to turn off the faucet. But in our case, our faucet is not functional, so I just ask for the person to stop pouring the water. That's all the procedure of hand washing. Now, I am going to perform the procedures of opening sterile packages, gloving, and maintaining a sterile field. So for the procedure, we need to determine what exactly the procedure that requires a sterile field, then check for the client's presence of risk for infection and their ability to cooperate with the procedure. After determining all of that, we need to assemble the equipment, the package containing a sterile drape, and sterile equipment as needed. Then confirm the sterility of the package. Ensure that it is clean and dry, and check for the sterilization expiration on the package. Then look for any indication that it has been opened previously. And for the possibly contaminated packages, follow the agency policy for the disposal. Now, for the procedure, you need to introduce yourself and verify the client's identity. Explain to them what are you going to do and why is it necessary and how they could cooperate to you. Then, provide for a client's privacy and observe for other appropriate infection procedure control. Then, for the opening of the package, if the package is inside the cover, remove the plastic. Then, to open the wrapped package, first thing to do is to place the package on the center of the work area so that the top of the flap of the wrapper opens away from you. Reaching around the package, pinch the first flap on the outside of the wrapper between the thumb and the index finger. Pull the flap open, laying it flat on the far surface. Then, repeat the side flaps, opening from the top one first. Use the right hand for the right flap and left hand for the left flap. Then, pull the fourth flap toward you by grasping the corner that is turned down. Then make sure that the flap does not touch any object. Now, to open a package while holding it, hold the package in one hand with the top flap opening away from you. Using the other hand, open the package as described above. Pulling the corners of the flaps well back. Donning a sterile glove could ensure the safety both of the client and the healthcare worker. On the preparation, we have to check for the client's record and ask the client about the latex allergy. Then, right after checking the record, assemble the equipment, which is the package of the sterile gloves. We need to ensure the sterility of the package of the gloves. Then, on the procedure, you need to introduce yourself and verify the client's identity and explain to them what are you going to do and why is it necessary. For example, hello Mrs. Afalia, I am Gurlitchi Vigilia and I'm going to put gloves to lessen the contamination of the hands and the transmission of microorganisms. Then, observe other appropriate infection control procedure and provide for client's privacy. Now, we can open the package of the sterile glove. Place the package of the gloves on a clean and dry surface. Then, if the gloves are packed in an inner as well as an outer package, open the outer package without contaminating the inner package. Then, remove the inner package by grasping the folded portion of the inner package. After that, put the first glove to your dominant hand. If the gloves are packed, they lie side to side. Grasp the glove for the dominant hand by its folded cuff edge with the thumb and finger of the non-dominant hand. Touch only the inside of the cuff. Then, insert dominant hand to the glove and pull the glove. Keep the thumb of the inserted hand Then leave the cuff in a place once the non-sterile and release the glove. Then, put the second glove on the non-dominant hand. Pick up the other glove with the sterile glove and insert the glove fingers under the cuff and holding the thumb close to the glove. Pull the second glove carefully. Then, adjust each glove so it fits smoothly. And pull the cuff by sliding the finger under the cuff. Remove and dispose of used gloves. There's no special technique of removing the sterile glove. Remove them by turning them inside and out. Then you could now dispose them. Document for the sterile technique was used in the performance of the procedure. Now, on adding necessary supplies, open each wrap package as described in the preceding steps. With the free hands, grasp the corner of the wrapper and hold them against the wrist of each other hand. Hold the package 6 inches above the field and allow the contents to drop the field. Keep in mind that 2.5 cm around the edge of the field is considered contaminated. Place the other supply on the sterile field by approaching from angle, then holding the arm over the field. Then discard the wrapper. So let's proceed on adding solution to a sterile bowl. Before pouring any liquid, read the label 3 times to make sure you have the correct solution. Now, obtain the exact amount of the solution if possible. Remove the lid or a cap from the bottle and invert the lid before placing it on a surface that is not sterile. Hold the bottle at a slight angle so that the label is uppermost. Then, hold the bottle of fluid of 10 to 15 cm above the bowl and to the other side of the sterile field. Pour the solution gently to avoid splashing the liquid. If the bottle will be used again, replace the lid securely and write on the label and date and time of opening. Then, using sterile forceps to handle sterile supply. Keep the tips of the wet forceps lower than the wrist at all times. Hold the sterile forceps above the waist level and within a sight. When using forceps to lift sterile supplies, be sure that the forceps do not touch the edge of outside the wrapper. Then, when placing forceps whose handles were at the contact with the bare hand, position the hands outside the sterile hand and make sure that the forceps is soaked in a soaking solution to maintain its sterility. Then, deposit a sterile item on a sterile field without permitting moist forceps to touch the sterile field. Then lastly, document the sterile technique was used in the performance of procedure. Thank you for watching. Have a good